Bio-D-Mulsion Forte Drops is a supplement that contains vitamin D, which is essential for your body to absorb calcium and phosphorus. These nutrients are important for building and maintaining strong bones. Vitamin D is also used to treat and prevent bone disorders such as rickets and osteomalacia. It is produced by the body when the skin is exposed to sunlight, but factors like sunscreen, limited sun exposure, and dark skin may prevent you from getting enough vitamin D from the sun. This supplement is also used to treat or prevent bone loss, known as osteoporosis, when combined with calcium. Additionally, it is used with other medications to treat low levels of calcium or phosphate caused by certain disorders. It may also be used in kidney disease to maintain normal calcium levels and support normal bone growth. Furthermore, vitamin D drops are given to breastfed infants because breast milk typically has low levels of vitamin D. The recommended daily dosage and the optimal timing for taking Bio-D-Mulsion Forte Drops will depend on your age, gender, and specific health conditions. Be sure to consult with your healthcare provider for personalized guidance. When taking Bio-D-Mulsion Forte Drops, it's best to take them by mouth after a meal, although you can also take them with or without food. Follow the directions on the product package, and if you have any questions, consult your doctor or pharmacist. Your dosage of Bio-D-Mulsion Forte Drops will depend on your medical condition, amount of sun exposure, diet, age, and response to treatment, so it's important to take this medication as directed by your doctor. If you're using the liquid form, be sure to measure the dose carefully using a special measuring device or spoon. Don't use a household spoon, as it may not provide the correct dose. For chewable tablets or wafers, chew the medication thoroughly before swallowing. And if you're taking the rapidly dissolving tablets, place each dose on your tongue, allow it to dissolve completely, and then swallow it with saliva or water. You don't need to take this medication with water. Certain medications, such as bile acid sequestrants, mineral oil, orlistat, can decrease the absorption of vitamin D. It's best to take your doses of these medications as far apart as possible from your doses of vitamin D, at least 2 hours apart if possible. Your doctor or pharmacist can help you find a dosing schedule that works with all your medications. Take Bio-D-Mulsion Forte Drops regularly to get the most benefit from it, and try to take it at the same time each day. If you're taking it once a week, remember to take it on the same day each week, and consider marking your calendar with a reminder to help you remember. If your doctor has recommended a special diet, such as one high in calcium, it's important to follow it to get the most benefit from the medication and to prevent serious side effects. And, if you think you may have a serious medical problem, seek medical help right away. When taking Bio-D-Mulsion Forte Drops, it's important to be aware of the potential side effects. While vitamin D at normal doses typically has no side effects, it's important to contact your doctor if you experience anything unusual. Your doctor has weighed the benefits of this medication against the potential risks, and many people using it do not experience serious side effects. However, it's crucial to be aware that excessive vitamin D intake can lead to harmful high levels of calcium. If you experience symptoms such as nausea, vomiting, constipation, loss of appetite, increased thirst, increased urination, mental or mood changes, or unusual tiredness, it's important to contact your doctor immediately. Additionally, while a serious allergic reaction to this medication is rare, it's important to seek medical help immediately if you notice symptoms such as rash, itching or swelling of the face, tongue, or throat, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, and if you notice any other effects, it's important to contact your doctor or pharmacist. As always, if you have any concerns about the side effects of this medication, it's important to consult with your doctor for personalized medical advice. Before starting Bio-D-Mulsion Forte Drops, it's important to talk to your doctor or pharmacist if you have any allergies to vitamin D or other vitamin D products. This product may also contain inactive ingredients that could cause allergic reactions, so it's essential to discuss this with your pharmacist. Additionally, be sure to inform your doctor or pharmacist about your medical history, especially if you have high calcium or vitamin D levels, difficulty absorbing nutrition from food, kidney disease, or liver disease. If you are using liquid products, chewable tablets, or dissolving tablets, it's important to note that they may contain sugar, aspartame, or alcohol. If you have diabetes, liver disease, phenylketonuria, PKU, or any other condition that requires you to limit or avoid these substances in your diet, be sure to consult with your doctor or pharmacist before using this product. It's also important to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products if you are planning to have surgery. If you are pregnant, it's important to discuss with your doctor whether doses of vitamin D greater than the recommended dietary allowance are necessary. Similarly, if you are breastfeeding, consult your doctor before using this medication. When taking Bio-D-Mulsion Forte Drops, it's important to be aware of potential drug interactions that could affect how your medications work and increase the risk of serious side effects. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. This includes prescription/non-prescription drugs and herbal products. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Bio-D-Mulsion Forte Drops include burosumab and phosphate binders. It's also important to check the labels on all your prescription and non-prescription/herbal products, such as antacids, laxatives, and vitamins, as they may contain calcium, magnesium, phosphate, or vitamin D. It's best to ask your pharmacist about using these products safely. It's important to note that vitamin D is very similar to calcitriol, so it's advised not to use medications containing calcitriol while taking vitamin D. Additionally, vitamin D may interfere with certain lab tests, such as cholesterol tests, potentially causing false results. Make sure to inform lab personnel and all your doctors that you are using this vitamin. If someone has taken too much of Bio-D-Mulsion Forte Drops and is experiencing serious symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of overdose may include seizures, confusion, and irregular heartbeat. Always follow the recommended dosage and seek medical help if you suspect an overdose. When taking Bio-D-Mulsion Forte Drops, it is important to have regular lab and medical tests to monitor calcium, magnesium, and phosphorus levels in your body. Make sure to attend all medical and lab appointments and consult with your doctor for more information. In addition to taking the drops, you can also incorporate foods rich in vitamin D into your diet. Some examples of these foods include fortified dairy products, eggs, sardines, cod liver oil, chicken livers, and fatty fish. This will help to further support your body's vitamin D levels. Remember to consult with your doctor about the best dosage for you and the optimal timing for taking the drops. If you forget to take a dose of Bio-D-Mulsion Forte Drops, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take double the dose to make up for the missed one. When it comes to storing vitamin D products, it's important to keep them at room temperature and away from light and moisture, except for alpha-calcidol drops, which should be stored in the refrigerator. Be sure not to freeze them, and always keep medications out of reach of children and pets. And when it's time to discard any expired or no longer needed products, it's best to consult with your pharmacist or local waste disposal company rather than flushing them down the toilet or pouring them into a drain. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.